You ever wonder why you get a headache or a symptom from the past pops up after you get an adjustment? To answer those questions and more, we'll be joining Dr. Miles Bodson. Dr. Miles, so glad you could be here today. How are you doing?
Hi, Kelly. Thanks for having me. I'm looking forward to the interview today.
Good. I'm sure you have heard from patients, I'm starting to feel worse after my adjustment. How can you explain how this happens?
Sure. You know, that's a great question I often get is, why do you sometimes feel worse after getting a chiropractic adjustment? Well, I'll just start by just kind of giving you an example. You ever been to the gym and worked out and you got feeling sore afterwards? I mean, that's not an uncommon experience for people to have where they've, the weekend warrior syndrome. People go out and they play golf for the weekend after they've been, haven't played in months, or they go running for the first time, or they did an activity they haven't done in a long time, and they go, my God, I feel like I'm, so sore. Kind of in the same vein. Now, when you get adjusted, there's a couple other reasons for this to happen. It's not just necessarily you get adjusted and your muscles are working differently like you exercise. Let me ask you this question, and that is, if you put your hand in a fire and you didn't feel it burn you, is that a good thing or not a good thing? It's not too good. Of course it's not good. That means your nervous system isn't communicating the message to your brain, and you'll end up getting hurt. You'll actually get hurt worse by not feeling the pain. You see, oftentimes our nervous system, when it's being impinged upon, which is a lot of times when you go to a chiropractor, you have nerves that aren't working properly, so they don't communicate the messages well. So the pain that's been there, you're just not feeling it. Just like if your hand was in the fire, if you didn't feel it, not a good thing. But when you got adjusted, suddenly those nerves have been woken up, and they're going to do what nerves do, which is transmit information. And some of that information, unfortunately, can be pain. I would say, unfortunately, it doesn't feel good. Nobody likes to be in pain. I totally empathize with that. I certainly don't like to be in pain. But it serves its purpose.
When you keep mentioning pain, is that the only symptom we may be experiencing?
Oh, that's a great point. The nervous system does so much more than just transmit the messages of pain. I mean, the nervous system transmits the messages of your body working more effectively, so your heart is working better. The nervous system controls your muscles, so you might suddenly notice that suddenly your muscles are working differently afterwards, or that your body is working different. And when I say your body's working different, what you might experience is like, oh my gosh, I'm going to the bathroom suddenly easier. Or I'm breathing better, or suddenly I'm not getting numbness down my arm, or I am getting numbness down my arm. And that's what we refer to as, there's a term actually called retracing. It's a term that chiropractors often use that talk about your body will retrace the steps that have been harbored within the nervous system. So, for example, you might get adjusted, and something you experienced months and months ago that you haven't experienced suddenly shows up again as you go through this healing process. Really? It's sort of like peeling the layers of an onion away. As you peel the layers away, you experience different things along the way.
So you're almost saying that you go through a reversal.
Yeah, absolutely. That's why it's actually called retracing. We often say that when people have problems, that the problem could go on for years and years before they actually feel a symptom, and that the symptoms are last to appear, and then in reverse, they're the first to go away. But just because they went away doesn't mean you're better already. I mean, think about the person who had no symptoms whatsoever, went golfing, and dropped dead of a heart attack. They had no symptoms. Their first symptom was death. There's no reversing from that. But you may have other symptoms that appear that aren't life-threatening or aren't going to kill you per se. But when you get the care, we'll often see the reversal process, that you'll go in a retracing process is probably the best way of describing it.
Okay, well, during this retracing, are there some common symptoms you see more than others?
Yes, there are, but I'm going to tell you one that I saw once in practice that blew my mind. Okay. I had a patient who came into me complaining of abdominal pain. That was one of his complaints. And we started doing chiropractic care on him. I started doing adjustments on him, and I was doing some pretty unique type work on him, and it blew me away. What happened was he retraced in the following way. After about a month of care, he started developing a boil on his abdomen. And then eventually the boil opened up, and what came out of the boil was a surgical staple. What happened was when he had surgery in his abdomen, a staple that wasn't supposed to be there was left, and his body was trying to reject it. And over a period of time, with the adjustments and his body working better, it actually came up through his skin. Now, I've only had that happen once in practice, but it's an interesting story that that type of thing was a retracing process. More common things we'll see is, headaches. People will start going through what's often referred to, they'll call it, is like a detox. They're going through a process where their body's getting rid of stuff. And they might experience things like headaches or numbness and tingling or difficulty sleeping or insomnia. Or I've even had people get off an adjusting table and suddenly they're having emotional experiences where they're suddenly laughing about something uncontrollably they haven't thought about forever. Or just the opposite, they're crying. They get off an adjusting table and suddenly the emotions come flooding out of them and they can't stop crying all the way home when they're driving home. They come back the next day, I couldn't stop. I couldn't stop myself from crying. There's all different kinds of experiences people can have. And that's the power of the nervous system. It controls and regulates everything we do in our life. So when you remove interference to it, there's a whole host of things that can happen. Anything your nervous system influences, which is everything, can be affected.
Yeah, I mean, okay, I can see people now asking, how does an adjustment push out a staple or make someone burst out crying? I mean, how does that work? I mean, people want to know.
Yeah, because what happens is when you get adjusted, what it's primarily doing is it's affecting our nervous system.
Okay.
The nervous system is our brain, our spinal cord, all the nerves coming out. And primarily what research shows us, it's really impacting the function of our brain. That when you get adjusted, and with modern technology, they've been able to do things where they could see the functions of the brain, the ability of the brain to function changes in a positive way when you get a chiropractic adjustment. So how does it do it? The body is a self-healing, self-regulating organism. It's going to do what it has to do to stay well. Just like when you break an arm or you cut a finger, the doctor doesn't heal it. You put it in a cast, you put a Band-Aid on it, and the body will do the healing over time. Right. So we're not saying that, so the body does itself. When you remove the interference, if you remove the dirt from the cut, or if you stabilize the bone, remove the interference of the movement of the broken bone, those are interferences to the healing process. When you remove those, the body will do what it's designed to do, which is to heal.
Good. So typically, how long should one expect to be retracing? I mean, is there a time period?
Well, that's a great question. It's different for everybody. There is no, I wish I had an answer saying, for this problem, for this diagnosis, you're going to have this problem. And, you know, with chiropractic, it doesn't work that way. You know, you could take 10 different people, they can all have the same complaints, adjust all of them, and you're going to have 10 different lengths of time for each one of them to get well. And that's because healing is an individual process. What works for you or what takes you to heal might take another person 10 days to heal from because of the fact that you've lived a different life. This point in time, you've done different things in your life. You've done the different things in wellness. For example, you may have been making it a point to live a wellness lifestyle of getting proper rest, getting proper nutrition, exercising regularly. You might have a better machinery than the other person who doesn't have a great machinery. Their body's deteriorated. They've been smoking all their life. They've been drinking alcohol on a regular basis. They've been putting McDonald's in their body all the time. That person's not going to necessarily heal nearly as well because they don't have the same tools and their body isn't made up the same as yours.
Sure. So you bring up a point for someone who hasn't lived the healthiest life but now is under chiropractic care. Well, can they do something at this point to help or speed up their retracing or their healing? I mean, you know,
absolutely.
What can
Listen
they do?
to your doctor. The advice they're giving you, the chiropractor is going to give you what we call wellness tips and wellness lifestyle choices you can make. You know, everybody knows they shouldn't smoke. So if you're smoking, don't smoke. Okay. If you know, everybody knows they should be exercising. If you're not exercising, exercise. Everybody knows they should be drinking plenty of water. If you're not drinking plenty of water, make sure you start drinking plenty of water. Everybody knows they shouldn't be living on sodas every day. If you're drinking lots of soda, stop drinking soda. I think you get my point.
Yeah.
You have a tremendous amount of control over what you do, what you put in your body, how you treat yourself, the decisions you make. It's all you. Ultimately, the person staring back at you in the mirror is who